All right, so we got Seth Weil aboard with us for the next 10 minutes. So Seth, come in.
Hello, good morning.
Nice
good morning, good morning. Stefan Reese and Synergy crew and all of our fans and viewers.
Well, when you sent me the topic via message yesterday, I was like, what is that? Retrograde ejaculation. Now I know topics revolving or focusing on men's health. You know, people already talk about it. Men a little funny with discussing it. You know, that kind of way. But, you know, here we are. Retrograde ejaculation. Explain.
All right. So that's why I choose to do these topics, to focus on men a little bit more, because, you know, women tend to have a greater interest in their health. All right, to have more of a concern, and men tend to ignore stuff until it gets extremely bad. All right. So retrograde ejaculation. All right, as the word suggests, retrograde. Retro meaning back in time or in the past. All right, or back, and grade means a part of direction. So in other words, it means simply a backflow of the ejaculate or semen. All right, so this is when you get a backflow of semen into the bladder when a man or a male climaxes during intercourse or sexual stimulation. So going on now, share my screen here, usual. Right. So here we have the male reproductive system here. All right, so at the bottom here we see in the testes, and they have the epididymis, which does look, I find this looks like you know, the aristocrats, the wig that they wear.
Yeah.
Right? So so sperm is produced in the testes, and through the epididymis it is transferred into what we call the vas deferens, which is this tube that travels all the way up above the bladder and comes all the way around and then enter into the prostate. As you see, this here is the seminal vessel, where seminal fluid is added, that is produced in the prostate and stored in the seminal vessel, and then it's added to the sperm to form the semen in order for ejaculation to take place.
Right.
Now, at this location here, so this here is the bladder. Let me get my little highlighter so that we could see it a little better. So this here is the bladder. Now at the bottom here you have a sphincter muscle, and you also have another one here, what we call the internal urethral sphincter and the external urethral sphincter.
Okay.
All right? Now during male climax, the internal urethral sphincter here shuts, it tightens, right? That is also what shuts in order to keep your urine in the bladder. All right. And the external one opens, and then you have the ejaculate flowing through.
Okay.
In retrograde ejaculation, the internal urethral muscle relaxes and the external one shuts. So when semen is supposed to go this way, it gets blocked and it goes into the bladder.
Oh,
right?
okay.
So sometimes what a male might notice is that you might have just a little bit of ejaculate being excreted through the penis, or after orgasm or climax, when they urinate, you have cloudy urine.
Okay.
All right. Now, this can cause and does cause infertility as well, because, of course, you don't get the volume of sperm, so it's less likely to impregnate. And sometimes you don't get any coming out, or it's sometimes what you call a dry orgasm.
All right.
So if a male is having a dry orgasm, it's very likely that they may have this condition. Not saying that this is the only condition that could cause such, because there are others, and we're going to take a look at those in coming weeks as we do more segment on topics affecting male health. All right?
Right.
So,
but let me ask you something before you go further.
What causes this?
Before you go to the cause. Is there a particular age that this takes place with a male, or is this something that could happen at any point in time to anybody at any age?
Right, so it's not something that's age related.
Okay.
All right. So risk factors would include, of course, having metabolic disease. So things like being diabetic. I know we see people can be diabetic at practically any age now. So being diabetic, having metabolic disease, whether it's cardiovascular disease, any of those things, which of course we know it's going to come back along to the diet. But the major causes are things associated with surgery, having surgery, where people might have surgery with regards to their prostate because they develop enlarged prostate or prostate issues, or medications. So you have medications like Flomax, which is a medication used to treat conditions of enlarged prostate and other conditions. There are other meds as well. And these medication causes these conditions. There's another medication or type of medication that causes this problem is blood pressure medication, which many people are on. All right, blood pressure medication. Now, this is also one of the reasons why I say what I focus on a lot is to get people off of medication, because you're going to take a medication and decide to deal with one problem and it causes another on the other side.
Yeah.
All right. When what we should do is address the underlying cause, because any ailment or disease in the body is just simply your body trying to get your attention to let you know that you are doing something that you should not do, and I need you to pay attention to that in order for you to change it to stop the damage that it is causing. All right, that is what diseases and sickness and ailments and stuff are. It's your body's alarm system. But we would rush and then we would go and medicate ourselves to suppress that. When we suppress that, the underlying cause continue. Now, though retrograde ejaculation is not a life-threatening illness, it's indicating to you that things in the body is not functioning as it should, which means that there are underlying causes that is causing that particular issue, which those underlying causes, if not addressed, can cause other issues elsewhere in the body that can be life-threatening. Right? Now, what I encourage people, because my program that I offer, which I am in a continuous state of trying to develop a new program, because remember, what I'm doing is basically new. It's offering a new alternative that did not exist before with regards to healthcare, reversing diseases instead of just managing or treating the symptoms of disease. So this is new. So I'm developing even better programs. So even people that won my program before, the program that I have developing now and is utilizing now with the current clients that are on my program is even a better one, because you know you always want to constantly improve yourself to give a better service to ensure that people get what they need. So what I am doing now is trying to revolutionize the healthcare system to make people become more self-aware, so that you will understand your body better, see the signs, be more observant, because many people really and truly aren't observant with their own bodies, right? Things might happen and we just take it for granted, right? If you feel a pain, it's not just a pain, it's something trying to tell you something. So you want to question and ask, why did I get this pain? What is it trying to tell me? So that's what I'm trying to get people to become more self-aware, and then show them in relation to the feedback that they would give to me for those that are on my program. When they give that feedback and I guide them, this is what it is one of the possible causes. You now become more conscious, right? More conscious of your body and what you are doing that may negatively affect it, and what you need to do in order to reverse it without, and this is the key thing, without the use of drugs, or medication or supplement.
Because somebody asked me, they said, how set does these things without medication? Nothing herbal, no, nothing. They were just mentioning things like that, and they were asking me. And I said, well, man, look, you got to call your number, you got to give him a WhatsApp, he'll explain everything to you. He's always willing to explain and give you information. Because people still find it hard to believe that there is a method through nutrition to reverse diseases. And usually when they see cancer, they kind of like, nah, not cancer. You know that kind of way?
And that's because we have been groomed to think that illness is random. Illness is not random. There is no random illness that anyone could get. All has a cause. All has a cause. And what we put into our body willingly has the biggest impact on our health. And this is the thing that we take for granted the least out of everything. We focus more on chemicals in the air than the food that we put into our mouth on a daily basis. We say, oh gosh, that air not good to breathe, you know. And you would go and stand up on a corner and buy something that have been soaked in a chemical product that have been extracted and gone through an entire process, like an oil field process, right? Like a chemical plant process, and we would eat that on a daily basis and believe it have zero impact on our health. Now, I find that to be a high level of idiocracy, right?
Yeah.
But that is how people think.
You know, we got
right? That's how people think.
No, we got to wrap up here. But I had to say that last part that you just said here, that take the cake. You know, people studied all kind of things. You know,
yeah, we studied all kind of thing.
But you're eating anything, you're drinking anything, you're smoking, you're taking drugs, but you're studying
all kind of stuff, and we think that has no impact. But don't use that shampoo, because that shampoo,
that shampoo
toxic chemicals in it, right? Yeah, that's the thinking.
The level of consciousness we are at.
Yeah, we have to become more conscious. So that's what my program does. It makes you more conscious,
right?
More conscious, more self-aware, right?
All right.
You can't be spiritual and unhealthy, yeah?
Exactly, right? exactly. So I'll tell you what, people, you can give Seth a call on 761-1952 or 279-3935. You give him a call, you could WhatsApp him on those numbers for more information. Fellas, if you know that you might have, little problems in that sphere, very private and confidential, of course, real patient confidentiality, you could call or WhatsApp Seth, because we know that a lot of fellas is dig out harass or talk to doctors and other people about situations like that. So we want to put you in a comfortable space to have that discussion. All right, so you could call or WhatsApp him today. Seth, thanks a lot, man.
Thanks for having me.
Yeah,
next
man,
week.
No problem. So with that, people.